We are live.
So good evening, pranam and johar to all of you. On behalf of Fogsi, I welcome you all in the 206th episode of this podcast that is the Gyan Pravah. My dear friends, every day on 8 p.m., we are coming with some very distinguished guests from the field who are giving their views, their inputs about what's going on. And today we are really lucky that we have none other than but I am a national president, Dr. Dilip Bhanusali sir. So before that, first sir, I would like to from on behalf of Sunita ma'am, we give your apologies. Ma'am is actually busy and unable to join. So on behalf of Sunita ma'am, we have our joint secretary, the very dynamic, my friend, my seniors, I can say my mentor, Dr. Ashwini Kale ma'am. Ma'am doesn't need any introduction. Ma'am is definitely, ma'am, I've always used to say, I have seen a glimpse of Sunita ma'am onto you, and definitely you are the left right hand of the Sunita ma'am. So thank you so much, ma'am, for joining, and over to you, ma'am, for start this podcast and for giving your blessings. Ashwini ma'am.
Thank you so much, Apurva, for the introduction. I think something has brushed off from Sunita madam to me also. Probably when you work with such great leaders, you also get to learn so much. A very warm welcome to Bhanushali sir. We were very fortunate to have him at AICOG and join hands with IMA to work against cervical cancer with our very great project of HPV vaccine. And we at Foxy are really thankful, sir, for joining an IMA with this project. And it is going on really well, where our target is training 50,000 general practitioners. So thank you so much, sir. And looking at the vast amount of work that you have been doing in IMA, there's so much to learn from. I mean, we hardly look after one or two small things, but then looking throughout India, it's a huge task. So, sir, we are very happy to have you here. And now, this year, Foxy has again launched a project just yesterday, which is a movement against thalassemia. So, I think if IMA joins hands with this too, probably will make a huge difference. So, we are creating an awareness program and training modules, sir, for gynecologists across the country so that they will start screening the couple, at least the female partner, for thalassemia, and we will be able to unite and keep thalassemia away. So our project is named as Mukta. And today, fortunately, we are at Haridwar as part of our Arogya Yoga Yatra that we have started since January. We started with Tirupati, and our Sampurna project on preconceptional care is also going on. So these are the various projects that Foxy has been doing. And I know with IMA, we can definitely become much stronger and could penetrate to much more masses with that. So welcome once again, sir, and I'll join in from the viewers link. Thank you, Apurva, for
Thank you. Thank you so much, ma'am. Thank you. And thank you to Bhanusali sir. So before we start the one-to-one podcast, just about Bhanusali sir, sir is the very dynamic, the IMA national president. So it is the largest, having over 4 lakh, members. Probably it is the largest in whole of the world. Sir has an academic, has a political, sir has a service of more than 4 decades. So, sir, your whole life and inspiration for all of us, for all the youngsters, and definitely the amount of work you are doing, sir. We are great to have a leader like you, sir. So, thank you so much, sir. And now we are starting our podcast. Yeah. So, thank you so much, Ashwini ma'am. Thank you for joining. Yes, thank you. Yeah. Sir, just my first question. Sir, you have a experience of more than 4 decades, and you have seen that what undergone has there in the healthcare, about the healthcare profession, about among the doctors, among the society, what the society's views. Previously, they thought doctors as a god, but now many a time they are thought that we are Satan. Sir, so just I want to know from you, sir, the differences, what you are seeing from at the time when you started your practice and now when you have the 4 decades of long experience. Yes, sir.
At the onset, let me thank Foxy, Dr. Sunita Madam, Dr. Apurva Datta sir, you being the host today. Thank you for getting me here because If you remember, when I took charge in December 29th, the next day I was in Bombay and I signed a MOU with Fogsi people about this HPV vaccination. That was a flagship program which IMA has started. Though it's not what is up to mark, but we are trying our best to train almost 50,000 IMA doctors. A lot of people are involved in this. Local coordinators, national coordinators, zonal coordinators. So a lot of work is going on. So I'm really thankful to Foxy people, especially Dr. Priya there, who has been doing a wonderful job there.
Absolutely.
As you have posed this question, the past challenges and the topic what actually was challenges in the healthcare system, past, present, and future. And that was the topic you selected for me.
Yeah,
Well,
absolutely.
we started our practice almost 45 years back, right? Uh, what was the problem that time? Let's just say there was limited access to the infrastructure. Number one, there was scarcity of hospitals, doctors, nurses, especially in rural and remote areas. Even in urban areas, I distinctly remember I started a 30-bedded hospital, and the latest, latest equipment I had was an ECG and an X-ray machine. There was no ultrasound that time. With that, and what we did, that was our clinical acumen.
Absolutely,
And
sir.
with that clinical this thing, we used to handle any type of emergencies. Not a single special, every specialty, right from gynec, ophthalmology, ENT, you name it, and we used to handle because we were trained like that. See, that time the limited was about that poor transportation, communication system were delayed. We didn't have cell phones, or that time there was nothing like that. Uh, and that time the communicable diseases were like epidemics like smallpox, cholera, tuberculosis, malaria. That was more prevalent in public health. Lack of vaccines that time, antibiotics, and infrastructure. More than that, there was low awareness and less of education among the public. Poor health literacy among the population, stigma around diseases like leprosy and tuberculosis, HIV. Then government policies like minimal government spending on health. Now also, if you see, the government allotted health budget is 1.9% of the GDP, where we require is almost 5%. So funding was very less that time. Weak health insurance coverage, most payments were out of pocket. Right now also, if you see the industry, health industry, uh, people, our patients have to spend, though they have insurance sometimes, but they have to spend out of pocket, where they have been, a lot of uh, uh, a lot of people have to sell out their houses, sell out their lands to treatment. So that was the past challenges. Now, if you come to the present challenges, there are durable burden of diseases, continued prevalence of infectious diseases like TB, dengue, malaria, rapid rise of non-communicable diseases like diabetes, hypertension, and cancer. There is inequitability and accessibility. Urban-rural divide in healthcare services, disparities due to socio-economic stigma, status, gender, and geography. Cost and affordability. If you see the cost, there is vast difference between a corporate hospital and a 20-bedded hospital. But unfortunately, what's been happening? What's happening? These small nursing homes is getting closed because of faulty government politics. Now, quality and workforce issues like shortage of trained healthcare professionals, burnout and migration of doctors and nurses, right? Not only throughout India, but a lot of people go abroad. Overcrowded public hospitals uh, if you see the primary health centers of our country, the infrastructure there is still not up to the mark. Though government has been trying to improve it, but if you still go there, it's unfortunate that our primary health centers are not up to the mark. Now there is a technological divide because now telemedicine has come and digital health tool rising, but many still lack internet access and digital literacy. So there should be pan-India preparedness for this. Though we have seen during last 10 years that internet has been gone to the remote villages also now. People are able to access. And unfortunately, the Google doctor is playing a very havoc there. Right? Now, COVID-19 exposed gaps in public health surveillance, ICU capacity, vaccine distribution, oxygen. Like we have seen that during COVID. Now, this is the present situation. Now, what are the future challenges? Aging population. We claim that 35% of our population is below the age of 35. But in the next decade, rising elderly population will increase demand for genetic care, palliative care, and long-term care. Other issues is climate change and health, heat waves, pollution, water scarcity, vector-borne diseases will increase the health crisis. Other important area is antimicrobial resistance. IMA plays a very important role. We have a separate wing in this antimicrobial resistance. Is a different committee. We have been forming this, and we have been accrediting hospitals and small nursing homes who adhere to this antimicrobial resistance policies. Now, technological disruptions like integration of AI, robotics, precise medicines, ethical concerns over data privacy and digital health, substantial universal coverage amid rising costs, balancing private sector growth with public health needs. And what you have seen is this: what is causing, especially in the youngsters, is the mental health crisis. Day in, day out, we see a lot of youngsters committing suicides.
Absolutely,
Probably,
sir.
probably because of stress, the amount of work hours they put in. We have been fighting for this, that the 48 hours this thing should be there in a week for union doctors. So these are the policies which the government has to see through, because a lot of stress is there in the junior doctors, not only for getting a job. Even if they get a job, the infrastructure being not there in the hospital, where violence is day in day out, we see violence against them. So there is no security to them. If you've seen the Arjikar case in Calcutta, what had happened, in spite of Supreme Court's due motus uh, concern over that, there is still no more infrastructure development there. So mental health crisis is still there. Global health security, preparing for future pandemics, bioterrorism threats, cross-border health emergencies are some of the global threats what we are facing. So IMA has a very bigger role in this, and IMA has been doing whatever best it can be done. But unfortunately, all of you know that we are the easiest target in the society, right?
Absolutely, sir.
And we don't have support neither from the government, neither from the bureaucrats, neither from the politicians, and even neither from the judiciary. You have seen our
Absolutely.
Consumer Protection Act, our concern about Consumer Protection Act when we went to Supreme Court, and we gave a this thing कि भाई when judges and lawyers have been exempted from Consumer Protection Act, why not doctors? It took them only 5 minutes to throw our application. So we are under CPA. Similarly, mixopathy, quackery, violence, GST. Um,
Absolutely, sir.
so these are some of the problems we are facing, and of course, doctor community is fighting, and IMA is doing whatever best we can do. Thank you.
Sir, thank you so much, sir. You point out very, very correctly that what that time, and it's really nowadays. I consider me as a young generation doctor. We even don't think of doing anything without ultrasound, without any investigations, and by the stethoscope and ECG and X-ray, you all are doing such a wonderful job. So thank you so much, sir. It's only because of the dedications from you that we are here. So that is very wonderful, sir. And you very correctly point out about the AI and all the things. And sir, and one thing, sir, I was there when you took over as a president IMA at Hyderabad. I was there because at that time I got the IMA President Appreciation Award from your hand, sir. So it was
Thank you.
really, it was a wonderful event and it was a wonderful conference, sir. IMA conference at Hyderabad, sir. So it's wonderful, sir. And sir, when you are talking about, sir, the violence against doctor, sir, just I want to know from you, sir, at that time when you were started your practice and like 4 decades back, is there some violence is actually there? है ना? Or is
To be,
there or something, and you are saying, and if there, sir, why it is now so much grown up? Is there something gap between the patients or doctor, or what is that, sir? I just want to know from you, sir. Yes, sir.
very, very, very pertinent question you have asked. In my 40 years of general practice, I have never faced a single day or a single moment. I had 30-bedded hospital where I had any violence. Now, the reason why I tell you was we used to give time to our patients. We were honest to our patients. We used to treat them as our family members. What has happened now? We don't have time. We don't give sufficient time to our patients. We are so busy, we hardly talk 2 to 3 minutes with them. The biggest problem is, communication. If you
Communication.
communicate with the patient properly, with a proper etiquette, with dignity and this thing, and listen to their problems. Listen to their problems is the most important. Half of the treatment is once you listen to them and you reconcile them, half of the battle is won there, which we don't have right now. Second thing is the aspiration of doctors have increased. I mean, the patients. With the cost factor increasing so much, ultimately everything is boiling down to the economics. If you see it, violence, why it happens, and when they come for the negotiation table. What they do, they ask that to waive off the hospital bill. They are not they are not worried the man who has died only. No doctor will see that his patient dies. They should understand. Plus, second thing, in olden days, they said that doctors are God. In fact, in every speech, I said, don't consider doctors also are human beings.
Human beings. Absolutely, sir.
Right? We also have our limitation. We also have, but then you can't take the law in your own hands. And no, what is happening? What we are seeing? They bring swords, they bring petrol, and they burn the hospitals. So for that, I think we have to blame something on ourselves also. We have to retrospect our approach to our patients. So as a president, I still say, in spite of so many hurdles, in spite of so many problems with the doctors facing, the Hippocratic oath we have taken, we should not forget that. We should treat our patient with empathy and sympathy. That is the only thing which is going to save us.
Absolutely, sir. Sir, very correctly said, sir. And even we are saying that, yes, we are seeing that there is a misunderstanding, or there is a increase, that disconnectivity between the patient and doctor. And you have very correctly that we are not giving time to them. Previously, we are saying that my parents are saying, "Arey, ye to family ka doctor hai. He's like our family." So we are not, we somewhat we are failed to do that, and people are not saying he is only doctor, he is not like a family doctor. So probably, sir, you have very correctly point out that, sir. And I think communication is one of the things which have to do. Now, sir, about the just to remember, because when the immediate past president Raghavan sir was the president, he started a
Ashokan,
declaration of, yeah, yeah.
Dr. Ashokan.
हाँ, अशोक सर, हाँ, yes sir, है
Ashokan,
ना?
yes.
हाँ, sorry. तो sir, he started, and one of his lecture I have seen, I have heard, I was there in audience. Sir, yeah. Sir has told that we should do work something like to not to degrade the education label of our students. because every year more than 1 lakh of MBBS doctors are actually,
Coming out.
passing out. And previously it was you also know, sir, many private colleges are there. It's only like same namesake only. And actually the quality is, sir,
It's going
might
down.
be it is decreasing. Sir, what's your views? Because IMA has very strong, oppose and that, and they're always, telling that there should be, the standard should not be go down. Sir, what's your views, sir, about that? Yes, sir.
With that, we had approached the health minister also. What is that so big rush? When they said that WHO standard, they said there should be one doctor among 1,000 patients. But we have crossed that. In Tamil Nadu, it is between one doctor among 550 people. In some states, 850. So there is no lack of doctors. There are thousands of doctors unemployed. So when they say doctors don't go to the rural areas, IMA gave this thing to the government that IMA will take the responsibility that to send doctors because people are ready. Give the infrastructure, proper infrastructure, doctor will definitely go.
Yeah, absolutely. Absolutely,
Your
sir.
voice is muted. No.
No, sir,
Now
you
it
are
is come.
audible, sir. Yes, sir.
Now it is
Yes, sir.
out.
Okay, sir. Yes.
So we have gone to the government about this. We said if you don't have interest, and what type of doctors you are bringing out, and with that, they are mixing up this homeopathic and Ayurvedic within Ayusha,
Mixopathy.
where
Yes,
they say that
absolutely, sir.
they will going to train in 1.5 years 50 surgeries to these Ayurvedic doctors. What are you bringing? You are bringing Jhola Chap doctors,
Absolutely,
right?
sir.
It takes
Yes,
10
sir.
years to do surgery. What are they thinking? And in 1.5 years, they are going to teach them. So mixing of this allopathy Ayurvedic is not a good idea. IMA is fighting tooth and nail to this.
Absolutely, sir. Absolutely. Very correctly, sir. Because I feel, sir, being a gynecologist, it will take me 5.5 year MBBS, then 3 years dedicated in the obs and gynae. And are doing thousand. It's like, our curriculum is so good, sir. And like first year, second year, and stepwise we are giving that. So after that, we are doing 3 year into obs gynae, and you are thinking that a person who is not even doing an MBBS don't know the anatomy of the human, and they are just by doing the 50 surgeries they are able to do. Absolutely, sir. It's a very correctly said, sir. It should not be there. And thank you so much, sir. You always bring out something new, and absolutely we are against it. And I also, sir, remember, sir, when I was there, because I'm associated with the IMA also, and I usually attended the IMA conference, the Gaon
How
Chalo.
gaon chale?
That was a,
How
yes,
gaon chale?
yes. हाँ गाँव गाँव चले, yes sir. So
How
that was
gaon chale?
again गाँव गाँव चले, yes sir. So that was again a wonderful initiative, and really, sir, and we are, sir, we are young, we want to work, sir, but definitely we want a infrastructure for that, what you have currently point out, sir. Yes, absolutely, sir.
How gaon chale
Absolutely.
is the flagship program right now. It was started in 2004, and some after this COVID period, it was somewhat went into a back door. But now we have started in a very big way. Almost 1,000 villages have been adopted by AMA.
Wow, sir. Wow, great, sir.
Not
Great,
only
sir. Yes.
see what we are practicing, telling our IMA members, it's not only medicine. The rest of the things like sanitation, vaccination, climate, environment, these things also be taught in the Ao Gaon Chale project.
Absolutely, sir. Very correctly, sir. Sir, we know, sir, and that what's the, because IMA, I think 2028, it will be the 100 years of established, sir, IMA.
Yes, yes, yes,
So,
yes.
sir, I just, and we all know what's the contribution of the IMA, and we have some leaders, and some, the cabinet minister of chief ministers from Dr. Fatniti. I just want what in you, because, sir, this podcast is for the general public also. Sir, I just want to know from you what why the IMA is so important, and what is the contribution of the IMA in the healthcare structure for the Indian population. Yes, sir.
IMA is the political front of medical fraternity, right? There are 18 specialized organizations.
Hmm.
So, mother of all this organization is IMA.
IMA. Absolutely, sir.
Unfortunately, all these different organizations have a tubular vision. They concentrate in their own field. They have their own politics. They have their own elections, academics. But none of them have bothered about this, all these various aspects of concerns of our medical fitness. So there, I may plays a major role. I may fight for them. I may go to the government. Unfortunately, we are not able to break that wall because everywhere, ultimately, you won't be surprised. 8 to 10 cases are there right now in the in Supreme Court. But the amount of money we have to spend on this, where do we get the money from? Nobody's contributing. In fact, I had a 3 meeting with FOMA people, all these organizations. I had requested them to, because you people also are sufferer of this.
Yeah,
It's
absolutely.
not members. All Foxy, ASI, API, dermatologists, cardiologists, everybody suffers.
Everybody suffers.
So unless we are united, strong force to reckon, government is not going to listen to this.
Absolutely, sir. It's very important, sir. And sir, I am associated with the sir Pink Health Mission. I know because I am working for the adolescent and I am a part of that. And similarly, we have a lot of programs, sir. And like cervical cancer screen, I was also the part. I was also the master trainer of that, and I have trained because I am working in a sir in a Jharkhand in a small district. So we also taught the medical officers about that how to screen that. Sir, these are the lot of programs is going on by the IMA. I just want to know from you, sir, what's impact actually, whether these are really impactful, sir, in giving a change in our society or in the doctors or in the patients' fertility, sir. How
You
impactful are these
see,
programs?
this program, you know how our doctors are, right? First of all, it takes so much of perseverance, so much of this thing to, first of all, regarding this SPV vaccination which we took with Foxy, it took me 3 months to make them understand that this program is not for vaccination. This is the training for doctors. People were not understanding that. It took 3 months to understand, make them understand that this is basically right now a training program for IMA doctors. Once we finish this program, we'll go for the vaccination drive. So similarly, see, people should know what's happened. We as from the center send circulars about various programs to the states. State in turn has to send it to their branches. My basic concern is all this program is not reaching to the primary members. And I've been trying with my level best to see that the primary members should be involved in this. They should know what's happening in IMA, what are the problems IMA facing. So unless what is happening, unless उसके गले में फांसी नहीं लगी तब तक उसको IMA को याद नहीं आता है.
याद नहीं आता है. Absolutely, sir. But sir, definitely these at least create the awareness. And in a definitely it's a C, sir, and it's just a drop. But when we at least start the initiative, definitely in long term, sir, it will has the impact, sir. So
Next week,
definitely, yes, sir.
for information, next week I'm going to start national wide basic life support program in a huge way. 1,800 branches, 32 states. Going to ask people to buy management and start, doing basic life support training to lay public. Our policemen, our municipal people, our people going on the road, in the schools, in the hospitals, in our patients. That's the best thing we can do. Train them in basic life support. So this I'm going to do it next week. I'm going to start this on a big scale.
Great, sir. It's really great, and I think, sir, basic life support. We definitely studied it in the MBBS, sir, but we just forget. But
Pardon me?
definitely, it's very important, and thank
What?
you so much, sir, for at
Yes.
least thinking an initiative because I think it is basic for any fraternity. Maybe you
Yes.
are from pediatrics, yeah, any
Yes.
fraternity, pediatric surgeon, gynecologist, anything. But I think
Yes.
this is a must for each and everyone, sir. So thank you so much, sir, for
Thank you.
bringing out that very important thing. I know, sir, you are very busy, so I will take just last question from you, sir. Sir,
Yes.
we are a huge country. Last year, sir, when I am represent Foxy and from India, I was there at AOFOC and we visited 5 hospitals in South Korea, Seoul. And we are seeing that, for the delivery in whole month, in a big hospitals, in a whole month, they are delivery like 30 or 40 normal deliveries or cesarean. And in India, in my college, when I have done, in one day we have a 30 or 40
30, 40.
delivery and
Yes,
cesarean.
yes.
So whenever we are comparing ourselves from West, we are always saying that we are not giving the quality things. Sir, so with this amount of, work we are doing, and with this amount of population we have, how we can give a quality, work to our patients, the quality treatment to our patient? I just want your views on that, sir.
See, the important question was uh, 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 our population with 1.4 billion people. And we are really fortunate we are in that country where I can see a doctor within 1 hour, any specialty,
Absolutely.
right? You go to US, they give 2 months, 6 months appointment.
True, very true, sir. Very true, sir.
Yeah? In 1 hour, any hospital, anywhere in the country, in a remote place, you can find a doctor and you will have treatment. So that is the biggest blessing we as Indians have. Of course, infrastructure-wise, this way it's improving, no doubt. With that amount of population, very difficult to, especially see, educating our patients, educating our public is the most important thing. Uh, the cleanliness around the hospital, the environmental, there are thousand and one things. But slowly, in last 10 years, we have seen improvements. We have seen that how things have improved. Unfortunately, corporate culture has inculcated in our culture. And if you know that 80% of our corporate hospitals have been taken over by the foreigners. So,
Absolutely, sir.
so though the expenditure part of is killing, insurance people are not helping much. They say one thing and they don't give. Yes, last Sunday I was in Chennai on this insurance business, and we there all the big insurance leaders were there. I told them, in small letters you like that, they write subject to subject to conditions, and insurance also now with this Pradhan Mantri Ayush Yojana, where they are saying this. But unfortunately, what we are saying is, if government hospitals are already there, why this Pradhan Mantri Yojana should come? The government should improve that government hospitals.
Yes. Absolutely, sir.
That
Absolutely, you
amount
have
of money,
correctly pointed out.
that amount
Yes,
of
yes.
money you pump in into this government hospital. People should see that they see your ministers, CEOs, MLAs, see them, go to the government hospital and take treatment. Automatic public will go there. So
Very correctly, sir.
some of the programs, especially this Ayush thing, you have seen Ayush. Government is hell bent upon making even a small hospital Ayush hospital, but they are not releasing money. Haryana has almost 20,000 crores money backlog. They stopped it. Yesterday, some other state has stopped it. Ayush. So if you don't want to push money, where will these small hospitals survive if they don't have money? Six months you don't pay the money. How are
Absolutely,
they
sir.
going to run? So these
Absolutely,
are
sir.
various issues. But I think we should not be too dejected with this. We should fight it out. We Indians are known for fighting it out, and we'll do it.
Absolutely. Very truly said, sir. And these are really the basic point. And it's really, sir, your every talk is an eye-opener for us, that what we are lacking, what we should do. Sir, just before we end this podcast, sir, just I want to know, what is your message to all as a president of the mother of all organization, whether it's a Foxy, IP, ISA, and you are the president of mother organization, that is the IMA. What is your message, your take home message to all the doctors, nurses, and
Hello,
all the patients who are listening to this podcast?
hello, hello, hello,
Yes, sir. Yes,
hello.
sir. You are audible,
Yeah,
sir.
yeah,
Yes, sir.
yeah.
Yeah.
See, my take. There are few five messages, very clear messages. Number one, uh, uh, membership drive. most important. Out of 13 to 14 modern medicine doctors, what is our strength? Only 4 lakhs. Oh, it is getting disturbed in between. Hello? 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 Hello?
So you are audible. Support him here.
Yeah. Hello?
Yes.
Yeah, I'm audible now?
Yes. You can continue, sir.
Yes, sir. So the membership drive is the biggest drive what I've been trying to do. Second thing is ethical practice. The most important thing, we should stick to our ethical practice. What we uh, uh, preach, we should practice. That's most important things. And for that, the NMC also is trying to inculcate this ethic in the medical curriculum, in medical education. Infrastructure, government should spend at least 5% of the GDP on the health budget. That's our demand. And some of these bottlenecks what we are facing about mixopathy, about violence, about CPA, CE, Consumer Act, and Establishment Act. These are the acts government should seriously think over it and see solutions for this. I think with this, I congratulate the Foxy
Absolutely.
people for bringing this. Thank you very much,
Yeah,
Napua,
absolutely.
and thank
Thank
you
you.
very much.
Yes, sir. Thank you. Thank you so much, sir. That even in
Right.
your busy schedule, in a short notice, you are there. And it's really a fruitful and eye-opener for all of us, sir. Thank
Thank
you.
you.
Thank you so much, sir. Thank you so much from bottom of heart, sir. Thank you. Thank you so much, sir. Thank you, sir.